Perspectives on the cholera outbreak, Director General, Nigeria Center for Disease Control and Prevention, Dr. Jide Idris, joins me on the news. Good to have you join us.
Thank you. Nice to meet you too.
So the Lagos State government is saying that, yes, we can hear you. The Lagos State government is saying that we're seeing a downward trend, but NCDC has now placed the country at high risk. Help us understand what that means and where we are in terms of the severity of the outbreak.
Well, based on the information reaching us and data over the weekend and requests from other states, there was a rapid dynamic risk assessment that was done between Friday and Saturday by the National Technical Working Group on Cholera. This is a technical working group involving subject experts on cholera, drawn from NCDC, different states, and our partners. They assessed the situation, and they came up with a recommendation that the cholera situation in the country now should be placed at high risk. There are 4 levels of risk. You have low, medium, high, and very high. They suggested that we should activate the incident operation center, National Operation Center for Cholera, so that we can effectively address this situation. The reason being that, having considered all the data available, there is still an increasing trend of suspected cases nationwide. We've seen more cases now in more states than we did in last year. The case fatality rate of cholera this year is about 3.5%, which is much higher than the recommended regional 1% for Nigeria. We are seeing cases again in more local governments and more states. And like you know, what cholera has to do with access to water, hygiene, personal hygiene, environmental hygiene, and environmental sanitation. And they suggested activation of this EOC, which we did this morning. We've appointed an incident manager who will coordinate all activities and work with different pillars drawn from different states. What they will do is assess, look at the various data we have, the situation in different states, and see how we can offer assistance to the key states, because they asked the response level 2. So we're going to address the key hotspots, like Lagos State, Bayelsa. If you look at our trend now, basically this recent figure between us now, we have about 1,528 suspected cases nationwide. We have 53 deaths, drawn from 31 states and 107 local government areas. We consider this case fatality as very, very high and unacceptable. And that's why this EOC was established, to address the situation and see how we can effectively bring down the death rate and the incident cases. That's the situation right now. Our data is drawn from various states.
Sorry to jump in, Dr. Idris. Just allow me to come in here. So basically, we're going to see a coordinated national response. But what about the approach we're taking in terms of treatment? Because earlier there was a report that we have run out of vaccine, the cholera vaccine in the country.
Yes, we don't have enough vaccines. We will never have enough vaccines because demand for vaccines globally and nationally is far outweighs the supplies. Nigeria is not the only case, is the only country recording cholera cases. So many other countries are also going to the same source where we're going to. The Honorable Minister for Health has requested for assistance from GABA for supply of vaccines. But my take is that vaccines alone cannot solve our problem. Vaccine is also one of the control measures. We know cholera has to do with access to water, sanitation, and hygiene. If you can effectively address these issues, we don't necessarily need to use the vaccine. In any case, the vaccine, even if you have the vaccines, the effect is not long lasting. It's not about 6 months to 1 year. And you have to give these vaccines even before you catch cholera. So the earlier we started addressing the control measures, other control measures, the better for us. When the vaccines come, we will not get enough. And so National Primary Healthcare Development Agency, we will prioritize which states or who to give the vaccine to. We don't deal with vaccines. So it is nice for us to address all other control measures. How we provide safe cleaning water, how we provide good sanitation, and encourage people to exhibit good personal hygiene, environmental hygiene. Like we say,
let's talk more about the control measures, because every state seems to be coming up with its own precautionary measures that residents can take. For example, we just took a story coming from Ogun State where they are talking about tiger nuts. Some people have said don't take zobo or locally prepared drinks. What would be the recommendation of the NCDC?
Our recommendation, what they are saying in different states is true, but in this case, I'm sure the causes or the sources are more than tiger nuts and other drinks. So whether it's tiger nuts or drinks, we need to address the issue of contamination. The problem is that they're using contaminated water or contaminated food. We need to stop that transmission. And that's why we need to deal with the issue of water sources. Now that the rains are here, NIMET has predicted a higher volume of rain, and that is going to lead to increased flooding. It's also going to lead to increased contamination of water sources. So those areas where they have shortage of water, they need to be addressed. This is where governments, state governments, local governments must come in. They must provide alternative sources of water for the people involved. They must provide, even if it's temporary sanitary facility for them to use, instead of this open defecation. And of course, they encourage all the necessary control measures all the states are providing for personal issues. This was also come to good effect.
So can we say that this is now a national emergency?
Yes, it's a national emergency because we advise now to activate this thing. It's on a high risk. And that's why every effort must be put in place. The EOC is to coordinate all response activities so that everything be done properly. Instead of the haphazard manner is taken. We will work with different states. We work with different stakeholders to address this. We address it to all the stakeholders. All our partners have expressed their willingness to support. Some of them are in the various states now providing support in the areas of expertise. And so our own role is to coordinate that, coordinate data and look at data, analyze data and disseminate information as quickly as possible. We will continue to give regular updates to the people on our response activities after coordinating all the various efforts at the various states. Our staff are in Lagos State right now. They're in Ogun State right now, working with them to assist in addressing these issues. We are going to other hotspot states to support them in bringing down this trend.
All right. Thank you so much for your time. I'm sure we'll continue to get information from the NCDC. Director General, Nigeria Center for Disease Control and Prevention, Dr. Jide Idris.
Yeah, thank you very much.